Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Cymbalta Duloxetine Withdrawal Side Effects and How to Manage Them. Cymbalta Duloxetine can cause a range of side effects when you stop taking it, especially if you discontinue it abruptly. This is known as a withdrawal or antidepressant discontinuation syndrome. Common withdrawal symptoms for duloxetine include dizziness, nausea, and trouble sleeping, among others. /r/n/r/n Cymbalta belongs to a class of drugs called serotoninnorepinephrine reuptake inhibitors, SNRIs. SNRIs are prescribed to help treat mental health conditions such as depression and anxiety, but may also be taken for other disorders such as neuropathic pain, nerve pain, fibromyalgia, and chronic muscle or joint pain. /r/n/r/n Stopping antidepressants like Cymbalta abruptly can be dangerous, so it's important to talk to your healthcare provider or psychiatrist if you want to come off the medication. /r/n/r/n This article provides an overview of Cymbalta withdrawal, its symptoms, and how to stop taking it safely. /r/n/r/n Getty Images, Bloomberg/Contributor/r/n/r/n Cymbalta withdrawal occurs when a person suddenly stops taking their medication or when they significantly reduce their dose. The following factors may influence whether you are more likely to experience withdrawal or discontinuation syndrome. /r/n/r/n Withdrawal symptoms typically emerge within a couple of days after stopping the medication. /r/n/r/n The duration of Cymbalta withdrawal can vary, but in most cases, symptoms will improve within a few weeks. However, some people may experience symptoms for several weeks, especially if they have been taking higher doses or using the medication for a long time. /r/n/r/n The most common side effects of withdrawal include /r/n/r/n Antidepressants with short half-lives are associated with a higher risk of withdrawal and should be tapered off gradually over a long period. These antidepressants and their half-lives are /r/n/r/n It is important to work with your healthcare provider when discontinuing Cymbalta to reduce the severity of withdrawal. /r/n/r/n The recommended approach is to gradually taper the medication off over a long period. Clinicians generally recommend gradually reducing the dose no less than 2 weeks before stopping treatment. /r/n/r/n However, tapering recommendations will be left to the clinical judgment of your provider, who will decide based on factors like the current dose of your medication and how long you have been taking it. /r/n/r/n It is recommended that dose tapers be scheduled for times of predictable or low stress, if possible. This would minimize confusion of symptoms from the taper schedule with natural stressors and help prevent disease relapse. Taper schedules can be as long as 4 to 6 months when considering multi-year use of the medication. /r/n/r/n Some strategies for coping with withdrawal symptoms include /r/n/r/n Stopping a medication such as Cymbalta suddenly can be dangerous, so it's important to work with your healthcare provider when weaning off treatment. They'll have you follow a gradual tapering schedule and offer guidance on coping strategies. /r/n/r/n Still, even when slowly reducing your dose, you may experience side effects associated with withdrawal. These are temporary, however, and you can sometimes manage them with the help of OTC medication. /r/n/r/n The author would like to recognize and thank Chinonso Lloyd Paul for contributing to this article. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.